Yeah, and I think that the other thing is that people don't realize that the cross contaminations again increase your risk of developing a deadly cancer.
Exactly. Exactly.
And
I always say, I'd rather them tell me they cannot do something. I'd rather them say, you know what, I can't do that. And let me take it on me and say, fine. Then say, yeah, we can do that. And send it out and it's wrong. I cannot tell you how many times that has happened.
exactly. What advice can you give people who think maybe they have celiac, or even people who have a lot of different symptoms and can't quite put it together or never have strung it together, and not even stomach symptoms, because as I understand it, gastrointestinal
Right.
symptoms aren't even present in 75% of celiac cases.
No, sometimes they're not present. The best advice I can give you is you have to get a doctor who's going to listen, and you have to get a doctor who is going to test you and test you correctly, because the amount of false negatives that you get from blood work and even endoscopies is astounding. Um, my best advice is to get to someone who really will do this correctly. And if you do get a negative and you still believe that you have it, you need to keep going. Because like I said, you do not want to leave this unnoticed. And what I always say, and a lot of people will disagree with me, it's my opinion, and also I mentioned Dr. Fasano to you before, and when I was speaking with him, it is his opinion as well, that this isn't a genetic thing. This is becoming an environmental thing. The food that we are eating is so highly processed. Years ago, back in the day when they were, banging the wheat against the rock, the natural gluten is the natural protein found in wheat was developing naturally.
I know that you just emphasized the need for whole and fresh foods to supplement the nutrition that your body still isn't absorbing even as it heals, and it may not ever heal completely. So that's a really vital um, message that people need to hear. And what I was thinking about when you were talking about um, the false negatives in the testing and to pursue it if you think you have it, another um, condition that mimics or has the same symptoms as celiac is a gluten sensitivity. So that's another medical condition to consider if you test negative to celiac. The symptoms are the
Absolutely.
same. The long-term symptoms may not be, but certainly the everyday life symptoms are the same.
Absolutely. And no one should be fooled. A gluten intolerance, a gluten allergy could turn into celiac disease if you're not careful.
Hmm.
So all it is just getting to the point where it starts to kill the villi. So if your body's already experiencing symptoms of allergy and intolerance, you shouldn't play with it. It's not worth it. I can tell you it is not worth it. I deal with it every day. This disease is present with me at every meal. It is present with me every day.
And coping in everyday life, you're a celebrity. You go to meals, you go to entertainment, things like that. How do you deal with that? And
I
are
stay
you
away from a lot of that stuff, to be honest.
yeah.
Um, it's not easy. I'm going to be honest, it's definitely not easy. There are days that I feel very confined, very trapped by this disease because I just want to eat, and it's not easy. It's not easy to just go eat. You need to constantly know, plan, think, question. It's a lot. It's a lot. It's hard on the people around you. It makes you feel bad. You apologize. You feel different. You feel like a pain in the neck when you have to question what's in something. You feel sick some of the time. It's hard. It's definitely not. It's not an easy thing. Um, that being said, you could still live a great life. I make everything from bagels to cookies to cupcakes to donuts and they're all healthy and they taste great. So You know, it just takes, it's extra work, it's extra time, it definitely costs more. But, you know, going out to dinners and being at functions like that, um, I now use it as an opportunity to talk about the disease. You know, I use it as a place to educate, whether people want to hear it or not. I think people need to know about it. You know, I remember a popular book that someone had given me about G-free eating, and it said, you know, if you're at a party, you know, talk about the latest scores on the football team, and blah, because no one wants to hear it, and you know, just to toward put the subject towards something else, and I think that is doing our community a great disservice. Look, you don't need to sit there and cry about it, but I think that not taking the opportunity to say what it is taking the opportunity away from someone else that may have a problem, that may not know why they feel like crap, that, you know, just another person to know what that word is, celiac. So, you know, I think it's an opportunity to share.
Is there anything that I haven't asked you that you want people to know?
Um, you know, I would just reiterate that, you know, putting your head in the sand if you have some of these uh, symptoms, it's really not, you're not going to escape it. So you might as well figure it out, because um, you can live a good life. You can. And you can eat the things that you want to eat. Like I said, it just takes a little extra time, but going undiagnosed with this disease, I'm telling you, I got diagnosed a couple years ago and I'm in my 30s. It did wreak havoc on me, and getting an early diagnosis is enormous.
One of the things that we discussed before we started filming this interview was the fact that you had spent so much time in therapy
Mm,
because these doctors kept saying to you, if you're the fact that you were depressed and having panic attacks to the point of agoraphobia, that it was all in your head. Not to
yeah,
mention the other symptoms were all in your head because of the resulting stress
yeah,
or the causal stress, however they viewed it. So what I thought is probably really important to reiterate is for people who have panic disorder or anxiety disorder, that they are the ones who should consider that it isn't all in their heads and to
absolutely,
pursue the
absolutely,
possibility.
absolutely. And yeah, forgot that that was before we started taping. The amount of times I was told that I needed an antidepressant and was given, you know, anti-anxiety medication, I can't even count. Um, Most of your serotonin lies in your gut. It's your second brain. If your gut is off, you are off. It's that simple. So if you are having these issues and you're not dealing with them, the depression, I don't care what medication you're on, it's going to persist. It The panic attacks, they didn't get better for me. They kept getting worse. And anybody who's ever dealt with panic attacks knows that when you have one, you never want to have one again. They're horrendous. And for anyone dealing with any kind of nervous issues, I mean, celiac damaged my nervous system. So I have to constantly keep myself in a good state with my food, otherwise it reacts. And I will do anything not to have panic attacks because they're horrendous. And anybody who's dealing with that or depression, they need to look at their diet. Celiac disease or not, they need to look at their diet because, like I said, serotonin is in your gut, and you need to figure out why you're feeling this way. And yes, life plays a part and stress plays a part in everyone's life. And, you know, depression is something that, you know, many people deal with. Um, but, I read this book, Spontaneous Happiness by Dr. Weil, and the statistics he gives in there about depression and the levels of depression that we have nowadays as accustomed to, as opposed to years ago, is outrageous. Now, do you think about, because our society is more advanced and we're all running around and everybody's so stressed? Yes, but you can also say our food is different. Our food is very different. So I believe it goes hand in hand. So if anyone's having problem with depression, panic disorder, you need to look at what you're eating. You need to, I can't say that enough.
Well,
It
and I
changed for me dramatically. That's one thing I will say changed dramatically. In the face of a disease, why wasn't I getting more depressed? I didn't get more depressed. Once my eating changed and my gut started to level out, and although I go through things every day with this disease, I'm in a much better frame of mind. My system is much more level. My moods are much more level. I don't feel unhappy. I mean, I was constantly at a stage of like, why am I not happy? Why am I sad? I don't feel that way anymore. That's enormous.
right, and I think the bottom line point is that you can't talk a disease away. You
No,
can't talk, and if that's where you're sent when you have an underlying medical condition such as celiac, you can't talk it away.
no,
It will only progress.
no.
And so for people who are therapy resistant, as they term it, it's something to be considered.
It
And
absolutely is.
and
Yeah.
there needs to be education within the psychiatric and the psychologic field.
Well, yes, education with this whole disease, about this disease. Like I said, if you look up Dr. Fasano, the man that put this disease in the medical book, he's doing so much work on trying to still unfold what this disease has. And like I had said to you earlier, he even did a study recently with schizophrenic patients. And yes, some, have a definite chemical imbalance, but there were some that had celiac disease and it was undiagnosed. So there is a huge link between what you're eating and how you're feeling.
Right.
Absolutely, positively. And you should not be quick. Everybody needs to be their own doctor in a sense. And I don't mean treat yourself. That's not what I'm saying. But I do mean you have been you for however long you've been you. And then you're going to go into a doctor and give them, what do they give us now, 10 minutes? And you're going to say, okay, I got it. I believe him. I'm not saying you don't, but you need to question. You need to research. You need to really sit quietly and say, that voice that speaks to you, that voice that always said to me for years, there's something wrong, you need to listen, because it was telling me for years, there's something wrong. And even though I was told so many other things, there was something wrong. So you need to listen to yourself, investigate. You know, doctors are human. They make mistakes. Some of them are fantastic, and some of them, honestly, just don't have the education about it. They're not taught nutrition in medical schools. So you need to be your own judge.
Very good. Thank you so much for your time. Really
Well,
appreciate it.
so welcome.